the swabs.
Melissa Williams has worked as a nurse in Philadelphia for 13 years. Few of them have been as trying as this one.
Yes, I am ready for a vaccine, but I do want to make sure that the vaccine is ready for us.
She's among the third of American nurses who told the American Nursing Association they're hesitant about taking a new vaccine.
It's going to be about 2 to 4 days for the test.
But her colleague, Tarek Khan,
I will be first in line to take the vaccine.
is not only willing, he's eager.
If there's something like a vaccine, you got to take it. That's the only way that we get out of this.
Both Khan and Williams have been in the thick of Philly's COVID fight since it started. They've treated sick patients, seen some die, all as they dealt with shortages of protective gear and testing supplies. The CDC says healthcare workers like Williams and Khan will be the first Americans with access to a COVID vaccine.
Am I comfortable being
among the first Americans vaccinated?
So that's a little hard to answer.
Williams says her hesitancy is based on history. Unethical medical experiments on black Americans date to as recently as the 20th century. It's why some African Americans are still skeptical of American medical institutions, even those working in them.
And that's the way a lot of us are feeling. We don't want to be the guinea pig.
Vaccine hesitancy bleeds across state lines, but not for the same reasons.
There are trust factors right now because the data is not quite out there yet, and the way it was presented initially does cause some concerns, the way it's being pushed through the process.
Delaware's medical director believes many in medicine are startled by the COVID vaccine's speed. It will be the fastest vaccine ever made in human history. Governments prepaid drug makers so they'd start filling vials before these drugs proved effective, safe, or profitable. But speeding up vaccine production doesn't mean sacrificing safety. If the FDA doesn't approve a vaccine, a drug maker can just throw the vials out. If it does get approval, you already have doses ready to go.
The approval steps are not being sped up. The safety trials are not being sped up. The process that was being sped up is making the vaccine in advance of the approval so that it could be released if the vaccine turns out to be safe and effective.
The CDC estimates 70% of us will need to get vaccinated to eventually end the pandemic. Frontline medical workers will again be asked to step up.
The vaccine is a game changer. This is what we've been waiting for.
They know they'll set an example their patients will likely follow.
I don't know if I'm going to be the first one to line up to take it. That's what I'm saying. Am I going to get it in the future? Yes.
In Philadelphia, I'm Mitch Blacher, NBC10 News.
Something else to note, many health centers and hospital networks require medical staff to have updated vaccinations.
Vaccination is always voluntary, but it can be a condition of employment. The nurses we spoke to expect the COVID-19 vaccine to eventually become a work requirement.